Welcome back to our conversation on mental health, and this is the second part of what we want to talk about. So, here we are going to emphasize the general perceptions people have about psychological disorders and dive deeper into children with mental health conditions, therapy, recovery processes, rights, and anything in between. So, we'd like to start with psychological disorders. This is something that is thrown about a lot on social media. You see people talking about how to know you have ADHD, how you know you have depression, etc. So I think we would just like to have brief explanations on some of the general conditions we see: schizophrenia, split personality, multiple personality disorder, or any other ones anybody would like to talk about, and just the differences and why do you think people throw these words about so much these days? And what exactly defines these things as they are?
Okay. So thank you for the question. Right. I believe it's in a quest to understand ourselves that makes us want to know more about the very feelings or the things we're going through. Right. But in some way, I would say that the exposure to social media has made it so easy for people to self-diagnose before they even attempt to try. Because in counseling, right, or with therapy, you would have to be assessed and tested. And then when you fit into, I did mention the DSM-5 manual, where your symptoms align with what the condition is, then you are diagnosed, right? And so when you have not gone through all this, in spite of how similar it may seem like on social media, because someone with that condition is speaking from their experience, you have not been properly diagnosed, and so you cannot say you have that condition. I've had people working here with some concerns, and interestingly, we have this discussion amongst us as a team. They always come having already diagnosed themselves without us running any assessment on them, right? And I find it interesting because yes, they're trying to understand themselves, but it's not so healthy, because then some go through depressed moments believing they have the condition even before they actually go through the process of diagnosis, which is not healthy. It would be better for a professional to diagnose. Then we can move it from there, having a treatment plan that can best work for you. If you have not, then you don't have a mental health condition.
Okay, what would you like to add on to that?
Okay, so let me just say, psychology, psychiatry, right, in terms of science, it's a relatively new and evolving field. People don't really scientists and people in general don't really understand the workings of the human mind. It's like, as I mentioned earlier as well, everyone has some form of, challenge when it comes to their mental health. It's only, as Mrs. Shah mentioned, they have a manual, the DSM. When your challenges fit a certain criteria, then you are diagnosed professionally. Even if you read the DSM yourself, it's not advisable to diagnose yourself as well.
Yes.
Something as basic as lack of concentration, mind wandering, emotional blunting. That's actually a very severe one, but something that sometimes you might feel like stress can even lead to that as well. Yes, that's not really a mental health condition. Those are just symptoms. And that reminds me of one thing. This is what one of my nurses told me. A nurse told me, yes, she was like, mental health conditions, right, are a syndrome. And that means they are like a group of symptoms. Most of them, maybe not all of them, I'm not sure about that, but they are a group of symptoms that come together to cause something even greater. That's when you are diagnosed. So if you have these symptoms, if you have the symptoms on their own in isolation, right, it's possible that you are not mentally ill, or you don't have a disorder.
Yes.
yes, it's possible that you don't have a disorder. But when some of these symptoms are, severe, moderate to severe, and they are related to each other, some related symptoms are present, that's when you can be diagnosed. Effects there, that's when you are diagnosed with the disorder.
I just want to comment that we also have some comorbidities with relation to that. If you are not so careful, it could be something else that you are trying to pin up as a disorder, right? So in practice, we use a lot of tools to come to that conclusion that an ordinary person might not be able to. That's why you need professional help to be able to diagnose.
Okay, thank you so much. So I think we also touched a bit on physical and mental health in terms of how they interplay with each other. And we are also starting to realize that there's a need to also focus on your mental health as well as you do on your physical health. If we could just have some deeper examples of the impacts that mental health can have on your physical health that you can actively see, because I think one of the issues is most people think that because it's in your mind and you can't see it, then, I'll just deal with it, as you mentioned earlier. But now that you can draw the link between the two, if we could just have a deeper explanation on that, and then, we can carry on from there.
Okay, so I started off with defining it as physiological, right? So basically, it's borders on it's showing physically, right, with regards to other health conditions that can generate out of your mental health condition, right? Somehow we seem to prioritize going to health centers to care for our physical health than to consider the fact that our mental health generates these physical conditions that we undergo, right? I just will want to start off very basic from an example of burnout. It's excess stress that breaks the body down to the point where it can no longer act because the body has shut down. Now you may have every passion, interest, everything possible you still want to work with, but the body has collapsed and is not willing to work, and it mentally transforms into demotivation for the very things you know you have interest in, because the body is trying to say it cannot engage any longer. That's just an example I will want to throw in, but there are a lot of anxiety has its ripple effect and how physically it affects your body. Phobia has the way it physically affects your body. We have this condition, or what we call OCD, obsessive compulsive disorder, and basically sometimes the person, a symptom would be somebody frequently checking, somebody feeling as if they are insects walking up. These are physical reactions that is a mental health condition that is having a physical effect, right? And so it's so important to factor in the fact that when you check out for your mental well-being, you are highly possible to have a safer physical health than not.
Thank you so much.
Yeah.
Would you also like to share your experience on that?
Okay, so my insight on this is regarding let's using burnout as an example. Right, hold on, I seem to have slipped my mind a little bit. Sorry, using burnout as an example. So you mentioned lack of motivation, you mentioned chronic stress. Yes, so the human body is built to preserve itself. It's built for survival, right? Yes, and these survival mechanisms have been strengthened over a long period of time, like since prehistoric time. But let's not go there. So the idea is you are built for survival. When the body notices that you are overworking yourself, like it's like a machine. Let's consider the body as a machine. When there's too much stress, too much pressure, when the joints are overworked, when the organs are functioning too much, because the body produces a lot of energy. The body consumes a lot of energy, right? Yes. So if it's too much, if there's an excess of functioning in the body, this is just my own understanding. If the body is working too hard and it notices that if it continues, it's going to damage itself. That's when the body shuts down. Because it's actually not a bad thing if you think about it. Actually, it's not a bad. It's a survival mechanism. It's a survival mechanism. It's a mechanism that is meant to keep you alive, basically. So that's using burnout as an example. Yeah.
Thank you both so much. So the next part we would like to talk about, I think we mentioned earlier, is children and mental health. So I think, at least in the Ghanaian setting, we have this funny idea of trying to put children off certain types of conversations because we don't believe that they are mature enough to have certain conditions or to be going through certain things. I think there's a lot of jokes about if you're in an African family and you say you're depressed, you just keep it in your room. Or if you're crying in your room and you're depressed, you just clean your place and then you walk out and you go and talk to your parents, right? So there's this funny, it's not supposed to be funny, but I think there's something worth mentioning there about how age ties into mental health. So I would like us to discuss the age, how it manifests themselves in different ages, and how can we encourage the healthy conversation for children in mental health.
That's a very good one, because in as much as we try to promote mental health awareness, I somehow, from my point of view, I feel we push it still from the agenda of adults more than children. So it's good you are bringing this perspective in. But the example you gave about depression is research proves that a lot of children suffer from depression, right? And so we cannot undermine the fact that children always have some form of issues they also deal with, in as much as we want to pick it up from the adult's age, right? Interestingly, when they come into therapy, if you are using the psychotherapy method or approach, you always will reflect into their childhood experience or their past experience. And so if that informs, or that approach informs into, then it means it has an effect. And so it should be addressed from that point, instead of us waiting for them to become adults before they get to now coming to have a discussion of these issues, right? And when you check what's currently happening, a lot of children have we have learning disabilities, and it picks up from childhood. It doesn't wait till you are an adult before you start off with a learning disability from childhood, and then it matures into adulthood. We have several autism and all these childhood disorders. They are from childhood till you become an adult. Even traces of anxiety, depression. We have what we call in our practice the biopsychosocial model, meaning somehow it's genetic. And if it is genetic, then it leans into from childhood before you become an adult. And so it should be that we should focus on mental health awareness from childhood, allowing children the open space to express how they feel and understanding them from their perspective. In practice, what I believe we do is that we open up the room for children to feel validated, because that's something culturally we fail to do, right? So we open up the room, and then you often will have to leave your adult bias to come into their space so that they can be able to relate their concerns.
Thank you so much. Would you also like to share?
The only thing I'd like to add to that is, I think the question was about having children. The way I understood the question is like, can children diagnose themselves?
Something along that line. Or can
Yeah.
children, or what, could you enlighten me a little bit?
So the question is about how mental health manifests itself, or mental health conditions manifest themselves in childhood.
Does it wait till adulthood or it starts from childhood? Yeah.
Oh, I mean, and then I think she has hit the nail on the head. It definitely starts from childhood. Like, there's most conditions, if anything, like she said, the biopsychosocial model, right? Yes, you have a genetic predisposition to certain challenges, certain conditions. You have genetically, you can be more anxious than others. It's a predisposition. There's nothing you can do about it. But then again, there's also nature and nurture, right? That's your nature. The nature is your environment.
Sure.
So the environment can also aggravate it. It can also mitigate it as well. So depending on how, like what she said, giving them an open space to express themselves and all that, or the contrary to that is suppressing them. That can also have an effect. Suppressing them will aggravate it. Allowing them to express themselves will definitely mitigate it as well.
Alright, thank you both so much. I think what you mentioned reminded me of the fact that when you are predisposed to a certain physical condition in your childhood, there's extra care there. But then when it comes to the mental side of things, then you seem to be lacking a bit. Because if
We think you're making excuses.
right, because if you are predisposed to, let's say, diabetes, you take the steps, right, to prevent you from having that extreme situation. But then when it comes to the mental health side of things, I think we lack a bit, which you both have mentioned. So thank you so much. So the next part of our conversation is
Excuse me,
about...
let me just add a little bit to that.
Okay.
Like I said earlier, psychology and psychiatry, they are relatively new fields.
Right.
So that's definitely the reason why
Right.
people are not so enlightened about these issues. Yeah.
Right, that's so true. So we hope that as time goes on, we pick up on these things quicker. So the next part is about therapy and communication in therapy. So I'm sure we've seen a lot of movies, a lot of series where somebody's lying on the couch and then there's somebody with a notepad just writing away, asking questions. So we'd like to know, what is therapy, and then other different kinds of therapy, and how does communication work in therapy?
Okay, so from practice, right, and from training, there are different types of therapy because we have different approaches, right, that are used in therapy, right? Therapy is basically offering support to someone with a presenting concern and being available to assist them in any way possible you can through the process, right? Sometimes it's managed. Sometimes the concern just goes off because we're able to eventually come up with solutions that can be able to take away whatever concerns the person brought. But it's just being there. I would basically say therapy is just being there for the person. What we do is to create an open space. So most of the time we overemphasize on confidentiality because we want to assure whoever comes to therapy of the fact that they can be themselves. So I think that's what informs those videos and pictures we see of people on beds and couches. Somehow people seem to assume we're trying to enter into the heads of the people. Some assume we do hypnosis to be able to uncover the things. Yeah, but nah. It's just trying to understand the concerns of the person and to be the support the person needs to. We come up with some suggested alternatives when necessary, but basically we don't make informed choices for the person, right? They have the ability and the right to their decisions and we allow them to. But I will still repeat, we have different approaches. We have eclectic counseling, we have direct, indirect, they are varied, even with our theories that we run with, because every theory informs the type of technique you would engage, right? So even with the theories, they are divergent, basic. They are very broad. I would say bordering on maybe 28 different approaches that could be used. And so we have choice, we have feminism, we have Adlerian, we have psychodynamics, which we say psychotherapy. Yeah, they are varied. And so the approach is not just same. But most of the time you look out for what is best suited. If you are an eclectic counselor, you look out for which one is best suited. But if not, then you could pick whichever mode or method you want to work with. Yeah, thank you.
Thank you so much. So Uma, I think as a peer counselor, you probably have a little knowledge on this as well.
Once again, Mrs. Shah said almost basically everything since she's a professional. But what I learned in my I pressed something. What I learned in my peer counselor training was that the goal, like she said, the goals, you as an individual already have the capacity to help yourself, right? So the goal of a practitioner is to empower you to develop your own solutions. Sometimes you suggest alternates, sometimes you make suggestions, right? You'll be like, okay, well, have you tried this? Have you tried that? Based on what? But it's always based on the input that you give, not necessarily that you come and I'll tell you what to do. Yeah.
Okay, thank you.
I just want to chip in that I would want it clear out there, because we often hear that in training, counseling is not advice. It's so much as part of our understanding. Oh, go to the counselor and you'll be advised on what to do. No. Counseling has nothing to do with, and we insist on it, counseling has nothing to do with advice.
Counseling has nothing to do with advice. Thank you so much. So the last part concerning therapy would be, or these interventions you mentioned would be the recovery process. So how do people generally recover, or do they recover from these conditions whilst going through therapy and other interventions you may provide, and how do they integrate back into their working lives, their personal lives, and so on? What does that process look like?
Okay, so mental health conditions always creates an impairment, right? That's as part of why we would know that it is a condition. It affects your productivity, it affects your daily activities as well. And so the moment you have that condition, right, you are put on a treatment plan. And it depends. Some treatment plans are just to manage the condition. And in most cases, we add medications to it, not just counseling or therapy, so as to help manage. But for the others that can easily be dealt with, right, or where we can problem solve and it's over, right, then for those we normally engage you in therapy for some time, and most of the time the duration of sessions always border in between 6 to 8 for an individual, right, and also for group counseling as well. Sometimes individual counselings can extend into 8 to 12 sessions, but most of the time it's bordered in between 6 to 8 sessions depending on how severe the issue is. But what we often do is two things: you refer or you follow up after termination. And so for the 6 to 8, it should be that you guys have met to a point where, as the counselor or practitioner, you are certain that the issue has been dealt with before you terminate. And so when you are terminating, you are only encouraging the person to still meet up with you because you just want to follow up on them as to what they are doing to ensure that they are taking good care of their mental well-being. Yeah, but aside that, if you cannot deal with the issue, or you've tried all that you can as a therapist and you were unable to assist the person through, then you have to refer to somebody else who can be able to deal with it. But most times, yeah, issues get dealt with. Yeah, I know it is a stigma out there that counseling is for forever. It's not for forever. Your issue gets dealt with. Yeah, more than managed.
Would you also like to share?
The last statement she made, honestly speaking, I don't see it as a stigmatizing thing, to be honest with you, because although counseling is not advice, right? It's like you don't necessarily always have to go to a practitioner to be counseled. Most of the time, it could even be a friend or something. So if you put it that way, right, you're always one way or the other. You always need a shoulder to cry on. You always need to feel heard. You always need a safe space, right, to sort of air out your frustrations. And when the problem gets too big for the laymen around us, the people who don't really know much about what you are going through, that's when you have to come to a practitioner. So that's the counseling that's not forever. Yes, that's how I like to put it. So in terms of recovery, right? Yes, that's what we're about. Yeah, so this is what a doctor told me way back when I was a child. That's even for physical illness. Like I was taking medicine. He was like, the medicine, the syrup or the medication you're taking is only going to do like, let's say 60-70%, sorry, 40-30% of the work. 70-60 it depends on you. It's the same for mental health. But even if they give you medication, even the therapy that you're even doing, right, the strategies that you come up with, the ideas that you generate, you still have to you still have to implement them. You still have to be proactive. You have to be I guess proactive is the right word. You still have to do something. But if you are inactive, if you are sedentary, if you don't actually get up and put in the work, nothing is going to happen. So at the end of the day, it all depends on you. Yeah, most of it, if anything, depends on you.
I want to come in a bit with what he's saying. We always say that we work with you or we work alongside you. That's to mean that to the extent to which you push, we push along with you. We cannot force you to do what you're unwilling to do. And that is what counseling is about. So basically in therapy, we give assignments, we give homeworks, but like he said, you would have to implement them. And as you are implementing them, then we are certain that we are on a recovery process, right? We often push for growth, right? Because somehow you would meet people who are finding it difficult to motivate change. Basic. So we try to encourage growth. And even when we meet people like that, to get them to be able to go along with the things they have to do to better their situation.
Thank you so much. So we've established that the work is still on you, the individual. So you just have a helpmate to guide you through your journey. So our concluding thoughts would like to be, what are some key takeaways you would like the Ashesi community to know about mental health and mental health interventions?
Okay, so I basically would say people should prioritize themselves. I know we are in a community where we came in for academics, basically, but at the same time, be self-aware. One, if you don't fully discover yourself, all that you are doing in here would eventually not fully make sense to you in full light. And then in some way, when you become self-aware, we encourage the fact that you should then take good care of yourself, which we say self-care, right? Where you would have to take in breaks, you should. There's something we push mainly for drug recovery, which is the news, which is nutrition, right? Water, sleep, and then exercise. Thank you. Yeah. And so as a human being, that should be a normal habit, not that you are being forced to. And if you keep living this way, it's very basic that you have everything coming alongside. I would lastly say we still have CCA, and it's an exceptional model. I feel is always undermined. We don't have this in most universities, but Ashasi runs this model where you have coaching, you have counseling, and you have academic advising that could be able to cater for a more rounded academic life and social life, right, before you would be able to leave the community. And so students should patronize this here.
Thank you. Now, would you also like to share your concluding remarks?
1 second, I have to. Seems to have slipped my mind again. Yes, I'm going to give a cliche. The cliche is what you usually hear is education is not a race. Right? This Inshra spoke about prioritizing your health. So if you, and earlier in the conversation, we talked about burnout. Yes, some people, I've spoken to some people who also experienced burnout, but because of one or two things, they were able to, manage, and currently things have gotten better because they had to follow up and everything. Yes. So the idea is, so I said education is not a race, right? Yes, that's even too narrow. Life is not a race. Life in general, you are not competing with anyone.
Yeah.
You are living your own life